don't have to do anything.
Better than ever.
Is it better than ever?
It's better than ever because
I'm like, I'm gonna make everything better. It's
Absolutely
awesome.
better than it's ever been.
Yeah, absolutely.
Desirable.
Yeah, we're gonna be thankful for things.
Even if you use
Better than ever.
Did that for a year or so and realized that I was just really going to be really nerdy, and I didn't want to do that, and realized, I was socially awkward enough naturally that I needed to go in another direction. And there were a couple of people in the physics department that were heading towards medicine, and I thought, that'd be interesting and good, and so I sort of followed in that direction, and that worked out. I got my physics major, but I took a lot of biology and chemistry and did all the medicine prereqs.
Yeah, and some people are set on being a physician when they're 10 years old, but that's not your story.
No, although, thinking back in high school, I took, you take the instruments that tell you what you're good at and what you should do. And it thinking back I was high in social service and compassion and things like that. So it was like, really fit being a pediatrician because you're one part social worker, one part scientist. And, so I denied that at that point, but it probably was accurate.
And that's an interesting mix because probably not many science people are that empathetic.
Yeah.
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 And
then,
so, well, and in pediatrics, in college, I swam and I coached and taught swimming and worked with kids a lot. And it just sort of worked that way.
Swimming.
Yeah.
Interesting. Did your kids swim?
Not much. Oh. They didn't like medicine either. So I wasn't very influential in that area.
There's the idea that, the apple doesn't fall far from the tree. And there's also the idea that like whatever you like, they're just going to go in the other direction.
How about you?
Yeah, same. I don't know. I don't know how it's going to shape up. Yeah, for sure. So you decide you're going to now do physics. You're going to do medicine.
Yeah. And my junior year, I sort of changed course and did a bunch of chemistry. And, I was in a small college where you could just sort of change course pretty easily.
Switch pretty easy.
Yeah.
And medicine's not something that you like. I'll say it like this: freshmen start and they can just say anything, because they're taking all the gen ed courses and they can say I'm going to go into nuclear physics or whatever, but talk is cheap. And as they start going through those classes, some of the students end up as comm majors and my majors, but you accidentally become a comm major, but you don't actually accidentally do a pre-med major.
Yeah.
You gotta want it. So you start there and then you go so you graduate and then you have to pick your trajectory, right? At some point, like what are you going to specialize in?
Yeah. So, medical education now is different, but back, 45 years ago, the first 2 years is all classroom and you don't really taste the hospital very much. And then your third year, you do rotations and you try different things. And, you spend time with internists and surgeons and pediatricians. And I liked being around pediatricians. They were temperamented the way I was. And you got a good variety of people. And I liked working with kids and liked working with parents. And
interesting. Yeah.
And it just worked out that way.
Yeah. Huh. So in those days, like you were 2 years in the classroom and you weren't in the practicing very much at all.
No. And now it's a little more integrated. I think they're you're in the clinic early on, probably in the first year, you're doing anatomy and then seeing patients, and they've changed it a lot.
When I was at A&M, I had to do it wasn't quite a minor, but you had to take 9 hours outside of the PhD, your own PhD program. And so I took history, and I took 2 courses in history, and there were a bunch of those guys who were going to school to be PhDs, to be professors, and they had never run a class.
Yeah.
And they had like guest lectured 3 times ever. And I just thought, this is wild. The speech classes are interesting because from the first day, you're a graduate assistant and they're throwing like papers at you and speeches at you. I mean, you're grading things, and they have big classes and dividing it up, and you're doing all this stuff. And so it's really cool because you get a lot of practical experience as far as like, do I want to do this or not want to do this? And my guess is that the teaching hospital or whatever, they don't want to have people graduate and then not go into medicine. So I guess they've changed it so that you have exposure to that.
Yeah. I thinking about it, I'm sure there were, I know there were people who got into the hospital and it was like, oh, I can't do this. I'm not good around people. And there probably still are, but they self-sort into pathology or radiology where they're just not around people. They sit in a dark room and look at TV screens all day.
Yeah. I know you, and I know a few other people, and my wife worked at a hospital for a while, and I just don't enjoy the hospital. I just really, truly do not and cannot imagine working there. So I'm thankful that there are people who want to work there. Yeah. So you go into the trajectory of pediatrics. What does that look like? Like, you do general stuff and then you start to specialize?
Yeah. Pediatric residency is 3 years. Okay. And your first year is rotations. You do a month in the nursery and a month on the general floor and a month in different specialties, and you rotate. And then your second year, you get more responsibility and you're supervising the first years, and you have electives where you spend it in infectious disease or endocrinology or, different places where you might be interested. And your third year is more responsibility and more supervision of first and second years. And then you either decide you want to go into general pediatrics and practice, or whether you want to do a fellowship and spend more time training. And I did a 4th year as a chief resident, which is an honor, but probably was, that's basically you're supervising everybody and doing schedules and, arranging for conferences. And it was valuable, but it wasn't probably the best use of my time. I
have lots of nursing students who come through my classes, and they say they want to help kids, and which sounds awesome. But Krista did, I think, a summer in pediatrics or something. And before she was a nurse, she was a tech or something like that. And so you say, oh, I want to help kids. And that sounds awesome. But the things that you're helping them through are horrible. And so you're having to see kids through their worst moments and their worst conditions and things like that. So, I mean, but through the whole thing, you're with it. You're still interested. You still want to go into pediatrics. I mean, you did a whole career in it, but
yeah. It, your perspective sort of changes. Your training is in the hospital, and they've made a lot of efforts at getting you out into the outpatient world. And pediatrics is largely a dichotomy. The training is in the hospital, and there's hospital specialists, and then there's the outpatient. What most people interface with is the general pediatrician who's in the office, and you sit and talk, and you look in your ears, and you deal with your family pediatrician, and that's a whole different world that you learn in your residency, but you really learn once you get out and practice, and the day-to-day how to do it is you've got the basics, but your first years in practice are very much a different story.
For sure. Yeah. Our story with you is interesting. So our kids went to you the whole time, and we had, or for the most part, like you are the gatekeeper, I guess, between the non-serious and they're like really, really serious. And so we had a situation where our oldest son started having tingling in his extremities and headaches and things like that. And normally we take them to you and you're like, this is fine. This is fine for the whole time. And it's just like normal stuff like the flu or whatever, and normal horrible stuff like getting thrown up on in the flu, but just normal. And then that time you're like, no, this is something that needs to be checked out. And so that was a big deal. And so you got to be the one to say yay or nay on that. You're the gatekeeper, I guess, from the not serious to the more serious stuff.
Yeah. And, that's what, I think that the training is hopefully what teaches you this is a big deal and this isn't. And then the art of it is dealing with the little stuff in an effective way and being able to handle this is little, this isn't, and where you go from there, and knowing the difference. When I have, being in Abilene, we weren't a big teaching facility, but when you had nurses or students, or when you're just training the people in your office, the important thing is this serious or is this not? And you needed to sometimes know that in the first minute or two, is this kid really sick or is this kid a little sick?
Yeah.
And is this a big deal or is this not a big deal?
Well, I don't know if you told me this or somebody told me this at some point, but if you want to make conversation with parents of little kids, you just say, is everyone well in the home? And then they just start talking because they're never well. Kids are always sick. There's always something going on.
There's always, if they're not sick, there's always the fear or the concern that there's something going on.
Yeah, for sure. Yeah, for sure. So you started in what year?
I started training in 80. I came here in 84.
Yeah. Medicine's changed a lot. Yes. A lot. What are some, the name of this podcast is Better Than Ever. So what are some things that maybe are better than ever?
Well, I've thought about that, and it's a mixed bag. If you just look at the medicine of it, there's a lot better than ever. And there's no arguing against that. If you start throwing in the economics and the politics and the all the other stuff, which other category, it gets confusing. But what we can treat and what we can diagnose and is definitely better than ever. And I would say right at the top of that is, the thing that I would think about first would be when I started leaving the big medical center in Houston, we had multiple kids in the hospital at any one time with meningitis, bacterial meningitis.
Really?
And when I came here, we had probably a dozen kids a year with bacterial meningitis that we treated. Haemophilus influenza and sometimes pneumococcal. And it was always a big fear. Kid had a fever of 103, 104. And, it was something we were always aware of, always afraid of, always had it in the back of our mind. And in those first few years, the vaccine for Haemophilus influenza, and then after that, pneumococcal bacteria became available. And that is not something we have to think about anymore.
It's not on our radar, right?
Right.
Yeah.
Right. It's like, no. Sort of like when, I was born in 54, and that was just on the cusp of the polio vaccine. And, we don't even think about that anymore.
Yeah.
But before that, it was. And, people don't think about meningitis anymore.
Meningitis is the one where you can't touch your chin to your chest.
Right. Your severe headaches, high fever, your neck stiffness. Yeah.
And because of that swelling there, you can't.
Well, the membranes of your neck and spinal cord are so inflamed that you don't want to move. You're just very stiff. And bacterial meningitis is dangerous, often deadly. And, viral meningitis is still around and is generally not as severe, but bacterial meningitis has got a mortality rate of 10 to 15% with treatment, and without treatment, it's much, much higher than that. And damage of deafness and paralysis and stroke and things like that if not caught. But we don't see it.
Right.
In vaccinated kids.
Right. Well,
there's the rub, which we can get into.
We'll get
if you drag me into that.
I want to drag you into it for sure. I want you to say all the things that you felt like you couldn't say before. So, and is that the vaccine that you had to have to go to college? You had to have it to go to public school?
That's the meningococcal vaccine.
Okay.
There are three major bacteria that cause meningitis: pneumococcal, Haemophilus, and meningococcal. And in infants up to ages of 4, it's Haemophilus and then pneumococcal. And then they can get meningococcal, but meningococcal is more transmitted and more common in groups of people that are in close quarters, college dorms.
Yeah. Do you ever feel like you're treating like 5 different kinds of people? Like pediatrician, because you're like newborn, infant, and toddler, like they all have different sets of diseases.
Yeah. And that's part of the question. Part of the diagnostic category is, who is this? How old are they? What's, and it doesn't always hold true, but statistically you sort of think, well, how old is this kid, and what's the more common disease? But you can't totally forget about, strange things happen. So
I remember Krista was working and I had to take our oldest Luke to a checkup. I brought him to you and we were talking about, I think, bottle feeding or something. I'm sure you remember.
Test me. Don't test me.
He saw 10,000 toddlers. But so, and you said, yeah, he'd probably be done with that. And I went home and I looked at the cabinet door and I was like, we're just done with that. Just that whole stage of life, we're just done. And I mean, not that you prescribed it, but I was just thinking like, this is crazy. But all those thresholds where, okay, they're in this stage for a little bit. Now they're in this stage. Now they're in this stage. But I never really thought about you seeing one kid as like 5 kids, actually, depending on the stage they're in. Yeah. Or I don't know how many ever. Yeah. So meningitis is different. Anything else that's different? What's different now? They say that. So one of my twins, he had to have his appendix removed. And are they treating with antibiotics now? Are they trying that?
There's a lot of data, and I'm certainly not up on that, but that's sort of the tendency now is some. So I think select cases. I think probably more in Europe, but where there's a waiting list for surgery, I guess. I don't know, but
yeah, that's true.
You can quiet it down with antibiotics and maybe later at a more convenient time, take it out, or maybe later not take it out at all. So, yeah. And I don't know the ins and outs of who's a candidate for that or not. Mine came out, so
mine did too.
Yeah,
but I wasn't a kid. But mine didn't come out. I just turned 18 when mine came out, but I guess once it pops up, then it's on the radar.
Yeah,
so I don't know.
Yeah, well, and if there's a obstruction, I don't. That's not
your wheelhouse.
Yeah, but I do know that that's more and more something that they want to consider. It's an interesting thing. If a surgeon doesn't want to do surgery, that's
give them some antibiotics. What diseases or conditions have become dramatically less frightening since 1984? Would you say 1984?
84.
Yeah, 1984.
I think certainly meningitis. Frightening is an interesting word. There's frightening and there's inconvenient. People get all crazy about ear infections. Ear infections are inconvenient. Kids uncomfortable, in pain, running fever, waking up in the middle of the night, missing days of work because a kid's sick. That's not frightening, but it's inconvenient. And, there's a big push to not treat ear infections, let them run their course, because a lot of them are viral, and don't treat with antibiotics. And that's sort of hard when somebody's, I've missed 2 nights of sleep and I missed 2 days of work, and you're telling me you're not going to give me medicine, and that may or may not be the right thing to do. And RSV, and this is also, I've been retired 2 years, and as I was retiring, there was a new vaccine for RSV. RSV was everybody was really afraid of RSV, and it can be nasty, but most kids got RSV in the first year of life, and it's a nasty 2-week illness, and it does put some kids in the hospital, and it can be life-threatening, but for the most part, it's not. And there's a vaccine for it now. And my associates that are still working said that this year the vaccine just totally made it not there. And I'm not sure what to make of that, whether it's the vaccine or whether it just happened to be a light year.
Interesting.
People were excited to get the RSV vaccine. The other vaccines were a big discussion and not of as much interest as the RSV vaccine. The RSV vaccine is because the RSV was a big fear for everybody. Yeah. So I don't think that was exactly what your question was.
No, it's okay. And what's weird is kids are sick so much.
Yeah.
They get so many things. Yeah. And like a 30-year-old, they wouldn't go through these 10 sicknesses. And it's not expected that they would be in the doctor's office that many times. But yeah, you're treating a population that's just sick sick all the time. So there's a lot of talk about all natural. And in my classes, I can't remember if I told you this, and I may have said it on this thing before, but all natural just drives me crazy. It just drives me absolutely crazy. And one of the things I always would sort of fantasize, I have this little fantasy, not weird, but this fantasy about I'm lecturing to a class, and then I come in and we're talking about language and all natural. And then I think it would be so fun. I wouldn't really do this. I think it would be so fun to get a cigar out And you unwrap the cigar, then you cut the end and you pretend like you're going to light it. And I'm like, what's the big deal? It's all natural. There's like a million things that are all natural that will kill you. Or, I mean, not that a cigar will, but there's so many things. You like if you get the mushrooms in your front yard and you wash them and you saute them and eat them, they will kill you, and they're absolutely all natural. So, so lots of like that language in the last 10 or 20 years has just taken off, where we equate all natural. What I was going to ask is, if it's 1800 or so, do the kids get all these diseases?
Probably not. I think a lot of what we're seeing is exposure is increased. Kids are in daycare. In 1800s, they stayed at home. They shared what they had with their 5 or 6 siblings.
Just right there.
And maybe they went to town, went to church on Sunday, and maybe got it there, but not so much. We're closer together and share things. The figure that we used was a kid will get 6 or 7 viral illnesses in a winter.
Wow.
And
every winter?
Yeah. But, they're all new viruses that they haven't been exposed to, so they're going to get them and share them with the adults in the family. And if it's something new, they're going to share them with each other. So, and when kids are snotty and congested, they're going to get a ear infection or a sinus infection from it. So it lasts longer and potentially, have a secondary bacterial infection from it.
That makes me tired. It just makes me exhausted.
And it as a pediatrician, when you see somebody coming in for the 3rd visit for an illness, it's like, oh, how am I going to handle this? And you hate to, you want them well. They want to be well, and it's like, how can I? And some kids handle it better than others. Some kids can shake it off, but it wears them down. They're not eating, not sleeping, and parents are the same. So
I don't get strep.
Yeah,
I never get strep.
Yeah,
but I'll get a sinus infection. I don't get them much anymore, but for a long time, as a grown up, I would just get it just for any reason. Anyway. So,
I can remember my first year in pediatric residency. We all were sick all the time. Yeah. It's like first year school teachers. They're in the classroom with all those kids. It's a little incubation period, they're just getting sneezed on all the time.
But then, so a normal winter for you, you're 40 years old. Did you get sick?
My last few years of practice, hardly ever.
Wow.
And I didn't get strep. I hardly ever got the flu. I get a flu shot every year, but I think in the last 20 years of practice, I got the flu maybe twice, and I'd get maybe one or 2 viral illnesses in a winter, but hardly ever. And it's just, but the first few years I did. It's just you got used to that, and you got pretty good at dodging the sneeze or.
That's the key that parents can't do. Right?
And oh, he's going to vomit here. I'll be back. here's the emesis basin, and I got thrown up on. Yeah. I mean, I'm pretty tough, but I remember one time, our oldest was he never just wanted to like cuddle, and I was watching a football game and he started cuddling me. I was like, oh, this is so sweet.
he's cuddly. And then he just threw up all over me. And I used my arms as a levee. There's 2 levees on each side because it was just everywhere. And then there was another time when one of them was on the top bunk and he's, Daddy, I think I'm going to, and
Cover the room.
yeah. It was really great. Anyway, yeah, they're exposed to, I guess we're just exposed to so much now. And I don't want to talk about COVID, but I think it's interesting that they never shut down the airlines.
Yeah.
And so, after it was, I guess, in the middle toward the end of it or something like that, the Stanford scientists came out, they were against it or whatever. And they're talking about that they projected that went around the world. It took 8 days and everything is just everywhere all the time now. Yeah.
And that was just, nobody knew what to do with that.
Yeah.
And, the first 2 weeks of that, we kept working and didn't know what to do with it. I moved out of the house into the garage apartment.
Really?
And then I finally realized we can't do this forever. And, I managed not to get it for 6 months. And, it was, by that time it had all mutated enough. So it really wasn't all that bad. It wasn't even, I've had the flu worse than that.
Yeah.
But it wasn't the early virus. And
so one of the things I want to talk about is there's a term called survivor's bias. And survivor's bias is, to define it, I don't have my electronics in front of me, but it's the idea that, like, you and I get in a car and drive 3 hours away and come back. And the whole time we don't wear seatbelts, but we made it there and back and nothing happened. And so I wasn't planning to talk about this, but I was actually talking to a mutual friend of ours who never wears a seatbelt and has been in 2 accidents and been fine. And he feels like that's confirmation that he doesn't need to wear a seatbelt. I'm like, no, this is not okay. Anyway, so that's survivor's bias. And so we were all born and we're all here and we all live to this time. And so that's survivor's bias. And so I feel like it's kind of in the last, with all the all natural organic stuff, with the vaccines, with the birth plans, with all this stuff, like the survivor's bias mentality it's just like infecting our brains and like our logic and how we're seeing things. So I don't know if you had experience with that. I'm trying to drag you in.
Yeah.
Yes.
I don't know how to dissect that all out. There's no doubt in my mind that vaccines are one of the greatest accomplishments of medicine.
Of human history.
Yes.
Yeah.
I think there's some nuance there. I think there's some vaccines. There's no doubt that the polio vaccine is much more valuable and has made a greater impact than the chickenpox vaccine. Or the COVID vaccine. Let's just jump right in. The politics of it and the economics of it is certainly complicates it all. So it's hard to know and to make those decisions. And I have a hard time pointing my fingers at anybody now. I think I can make strong recommendations that these are the ones that I think are very important, and these are the ones that I'm not going to die on that hill.
Yeah.
I have family members that I've had that conversation with, and they have to make the choices that are best their responsibility, as we I think talked about this morning. You know, I make decisions.
Yes. That's exactly right.
For me.
What can I control and what can I?
Right?
Can I not?
And you know, and the current turmoil over the current administration and the FDA and the CDC, and you know, and are there side effects, and what are we doing that we don't realize the long-term side effects of? You know, do we need to step back and maybe do some other studies? I can't argue against that. I mean, that we're giving all of these vaccines that we didn't give originally when we started, and are we seeing complications from that? I don't know. Our vaccine schedule is different than other countries, and are we seeing something different? I think that's a good question. There's a contrarian Dr. Vinay Prasad. I don't know if I said that right. He's actually an oncologist, I think, out of Stanford. He took a year sabbatical and was worked at the FDA for the first year of Trump's presidency this time, and then he stepped back, and now he's back at Stanford. And he was very critical and very vocal during COVID about, hey, we need to be doing studies. Fine, let's do this, but let's do studies and see what's going on. And he makes a lot of sense. He's very contrarian. He's just asks lots of questions, and he's, you know, I don't have answers. I want answers. Let's do some studies. Let's find out what we don't know. And so, I don't know, what was the question?
Survivor's bias. I don't know.
Yeah.
But
you know, so yeah, we're doing things that seem to be good. You know, the COVID vaccine just opened up a whole can of worms. With, I think there are some side effects. I think the whole messenger RNA technology hasn't really been looked at. And is there something there that it's causing that we don't know about? And we're, you know, diving headlong into that with other vaccines. It's a cool concept, but is it doing things that we don't know? Are we gonna jump into that with flu vaccine now? And I don't know.
No,
I don't know.
You have an interesting perspective because you practiced medicine before the internet. And what happened when the internet came along with information with parents? What happened to parents?
Yeah. All the information that's available has been devastating to us all, paralyzed us. There are still a few parents who just come in and say, yeah, what do I do? I'll do it. But I'm hearing from, you know, I retired at a very opportune time.
Yes.
The few years before, especially over vaccines, but really about everything, you know, people were starting to have more information, and I think that's good. You know, obviously the days of just do what the doctor says and don't ask questions needed to be over, and more information is better. But the internet doesn't give you any nuance at all. It just throws all this out here, and you don't get any sense of this is really common and this is really rare. You need to think about this, and you really don't have to think about that. And you know, just like every time somebody has an auto accident in Timbuktu is not important for us to know about. Every case of some rare parasitic infection in India is not important for us. I mean, every time we have a new outbreak of something in Africa, we get up in arms here.
In media studies, it's like, if it bleeds, it leads.
Yeah.
That's what we say. And there's also this phrase that's been floating around the last couple of years where it says something like, planes that land safely don't make the news.
Yeah.
So if it's weird, it's gonna make the news for sure. Yeah. One of my favorite topics to bring up about information, because I literally don't know. I don't have a dog in the fight at all, is fluoride.
Yeah.
And because you talk to some people and they are ready to go to war over fluoride. And then the other people are like ready to go to war over like, no, these are the no fluoride people and these are the fluoride people. And they're like fighting and all this stuff. And I don't know. There's so much information right now that I have no idea. I just kind of throw my hands. I'm in this whole like the whole process and like what's better than ever and all these things. I get tired and then I just want to give up. And it's just because I don't know who to trust or what to trust or anything. And like what you're saying, there's certain circumstances where, like, it depends. It depends on like, this is okay and this is not okay and things like that. So. Yep.
There's so much information out there, and it depends on where you go and who you listen to. There's and what tribe. there's an epidemiologist who I get her blog every day, and it's very inflammatory and and then it's like, really, I just can't get too concerned about it. And she's pretty easily disturbed, and she includes gun violence and automobiles. She's on the whole list and I just want to know about the infections. She's all on the cyclospora and lettuce, and I go, okay, I don't really need to be listening to this.
Yes. It's not good for you. All the information is not necessarily good for you. So like a lot of what I study is media stuff. And so when it comes to kids and diseases, what do you think, what's a show or a movie that lives in our minds about a kid's disease? I read this book called, I don't even think it's in print anymore. It was Makers of the Modern World. And it was so great. And it gave like 3 pages on all these people, like inventors and politicians and everything.
Oh, yeah.
And it just made me think of like all these people like Pasteur or all the inventors that made our life better. It's pretty cool. Or who's the inventor of the vaccine, or not the vaccine, penicillin.
Oh
yeah. All those guys, all the things that we're standing on today that we don't even think about.
Yeah. I don't know why I thought of this. I read a book called Cobalt Red.
Okay.
It's it's crazy. It's about the mining industry in the Congo and the depravity of what these people go through digging cobalt out to allow us to have EV vehicles and they're kids and men that are digging by hand and how just the loss of life and limb and the poverty they live in.
We need to get him some shovels.
Yeah.
Yes. Drop off some shovels over there.
I read that a while ago. I don't know why that popped into my mind.
Blood diamond.
Yeah. Sort of like that.
Yeah. Something like that. Yeah. What do you want to plug? What should we be aware of?
I guess just try to have a balance of what you're looking at as far as the whole vaccine debate. I think they are, by and large, a wonderful thing. There, a few years ago, when all this started and parents were spending a lot of time debating vaccines or not and what vaccines, and we were spending more and more time talking to parents about what vaccines and why, and we as a practice got to the point where we're spending so much time. We said, we'll talk about this once, and you either vaccinate or not. And if you don't vaccinate, then you don't trust us, and that's not a very good relationship. And you probably need to find somewhere else. And then that evolved to the point where the state said, well, if you take Medicaid, people have a choice, and so the practice is now said, people have a choice, and you can't.
So you had to take them.
Yeah, you have to. People have a choice, and you can't deny somebody care if they don't want vaccines. And I think that's probably the right way to do it, but it's very time intensive, and I think it's reasonable to spend some time with people, but not. There are people who are just don't want to really. They don't want to discuss. They want to argue. I heard there was a podcast in NPR or the public radio station used to have, I haven't heard it recently, but they used to have a holistic medicine podcast in the afternoon, or a show on in the afternoon. And it was, there was a holistic pediatrician that was talking about vaccines. And I thought, I think I know where he's going to go with this. And I didn't. He surprised me. And he said, he came on and said, I talk to patients. When I trained, we used to see children coming in with meningitis and dying all the time. These vaccines work. They are safe. They've changed what we do. I recommend them. I think it's worth thinking about them. I think it's worth talking about them, but by and large, they're worth doing. And, and I think there's a nuance to them. Yes, there's issues. I think there's some ethical things to think about. There's some of the viral vaccines, to make a vaccine for a virus, you need to have a living cell, and some of them are made with cells from animals. Some of them are made with aborted fetal tissue that you have to deal with that ethically in your mind, but they make a difference in children's lives, and it's changed the landscape of what we see with kids. And there's a lot of information out there, and I think you want to look at both sides,
or just be like me and be totally exhausted and overwhelmed.
Yeah. Say, roll up your sleeve and give it to me.
Yes, just give it to me. That's right. Well, Greg Tuegel, we're at an hour. So,
okay.
Yeah. Thanks for coming by. It was fun to talk.
Sure.
Yeah.